Hello everyone. Today, we're diving into the world of a medication called Adalimumab, commonly known by its brand name, Humira. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Adalimumab, often recognized by its brand name Humira, is a biologic medication that falls under the category of TNF, tumor necrosis factor, blockers. It works by targeting and neutralizing TNF, a substance in the body that causes inflammation and can lead to immune system diseases. Initially approved by the FDA in 2002, it's used to treat various autoimmune conditions, including rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, Crohn's disease, ulcerative colitis, plaque psoriasis, and juvenile idiopathic arthritis. Humira helps reduce the signs and symptoms of these conditions, improves physical function, and inhibits the progression of structural damage. It is also prescribed for non-infectious uveitis, an inflammation of the middle layer of the eye. Warnings: Adalimumab comes with its set of precautions. It can lower the ability of the immune system to fight infections. Serious infections, including tuberculosis, TB, bacterial sepsis, invasive fungal infections, and infections due to opportunistic pathogens, have been reported in patients receiving Humira. Patients should be tested for latent TB before starting Humira and during therapy. If latent TB is detected, treatment for TB should be initiated prior to starting Humira. Humira is also associated with an increased risk of malignancies, including lymphoma and other cancers, some fatal. Before taking this medicine. Before starting Adalimumab, several factors need consideration. It's essential to inform your healthcare provider if you're allergic to the drug. Given its impact on the immune system, those with infections or a history of recurrent infections should discuss potential risks and benefits with their doctor. If you have any history of TB, hepatitis B, heart failure, lupus-like syndrome, demyelinating disorders, such as multiple sclerosis, or any other immune system conditions, it's crucial to inform your healthcare provider. Regular monitoring is advised for those with these conditions. You should not take Adalimumab if you have an active infection or are at risk of infections, as it can worsen or increase the risk of new infections. Inform your healthcare provider if you are scheduled for surgery, have any open cuts or sores, or have recently received or are planning to receive a vaccine. Live vaccines should be avoided while on Humira. Before starting the medication, inform your doctor if you have ever had cancer, liver problems, blood disorders, nervous system disorders, heart problems, or if you have a history of allergic reactions to rubber or latex. It's also essential to let your healthcare provider know if you are pregnant, planning to become pregnant, or breastfeeding. The effects of Humira on a developing baby or breastfeeding infant are not well known, so a thorough discussion with your doctor is recommended. Side effects: all medications can have side effects, and Adalimumab is no exception. Common side effects include injection site reactions, such as redness, rash, swelling, itching, or bruising, upper respiratory infections, headaches, and rash. Some individuals might experience more severe side effects, such as serious infections, TB, fungal infections, neurological reactions, such as dizziness, numbness, or vision problems, or signs of heart failure, such as shortness of breath, swelling of ankles or feet. It's essential to be aware of these potential side effects and consult your doctor if you experience any unusual symptoms. Additionally, there's a risk of developing new or worsening conditions, such as lupus-like syndrome, liver problems, blood problems, and certain cancers. Signs of these conditions can include persistent fever, bruising, bleeding, paleness, or unusual tiredness. If you notice any of these symptoms, seek medical attention immediately. Furthermore, Adalimumab may cause serious allergic reactions, including anaphylaxis. Symptoms can include severe rash, itching, difficulty breathing, and swelling of the face, lips, tongue, or throat. If you experience any of these symptoms, seek emergency medical help right away. Interactions: Adalimumab might interact with other medications. It's of utmost importance to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. This includes other biologic medications, immunosuppressants, and live vaccines. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Adalimumab. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The dosage of Humira varies depending on the condition being treated. For example, for rheumatoid arthritis, the typical dose is 40 mg every other week, but this can be adjusted based on individual response and specific condition requirements. It's administered via subcutaneous injection, and patients or caregivers are often taught how to administer the injection at home. Always ensure you're taking the correct dose and never alter your dosage without consulting your healthcare provider. Avoid. While on adalimumab, it's advisable to avoid live vaccines and being around people who have received live vaccines, as your immune system's ability to fight infections may be reduced. It's also recommended to avoid contact with individuals who have infections, as you may be more susceptible to catching infections. FAQ. Many wonder about the age restrictions for adalimumab. It is approved for use in adults and children aged 2 years and older for certain conditions, such as juvenile idiopathic arthritis and Crohn's disease. However, its safety and effectiveness in younger children for other conditions are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of adalimumab. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.